Welcome to the eLABorate Topics podcast, where we focus on lab-specific strategies for medical laboratory professionals. We're proud to be the healthcare detectives that work behind the scenes to get the results needed to influence medical decisions. Let's grow together and jump right into the lab.
Hello, everyone. Welcome to eLABorate Topics podcast. We are your hosts, Lona Small, Tywauna Wilson, and Stephanie Whitehead. And we're really happy today to have you because we're having a very timely discussion, and that's on our inspection, lab inspection, and how COVID has affected the way we do our inspection. So today we're going to just have some discussions on our experience with preparing for inspection. So with COVID, there's the opportunity to either do a virtual inspection or a hybrid inspection. So with the hybrid inspection, you have a chance to share documents virtually. However, the inspectors will come into the lab for a limited time. And with a virtual inspection, it's fully where the inspectors are communicating in a digital format through either Skype, Zoom, and there's a lot of challenges that go with both, and there's also benefits. So we're going to jump in and we're going to talk about our experience, and maybe you have some experiences from your lab, or you can learn from where we are in our journey. So I'm really excited to jump in. So, Tywauna and Stephanie, so far, what has been your experience in preparing for inspection during this time?
So, in terms of our laboratory, it's been a very interesting journey because our laboratory has had one regulatory inspection, not by the CAP, but actually by another regulatory agency. And that actually was pretty early on into the pandemic. And because the inspectors were small in size, they actually came on site. But a lot of the things that have changed, and now you can hardly have a conversation without talking about COVID and the new precautions that COVID has brought into our world. And using the phrase "new normal" is pretty, standard now. And so being that this is our new normal, the different guidelines for guests coming into your facility or your laboratory or your organization, the new guidelines for, number of people you can have in one space, and, the cleaning that needs to happen before and after that space. Those are the type of things that were different for us in preparation for that inspection and for that assessor to come on site. So thankfully, the CAP worked kind of as a mediator between us and that agency to send them documentation so they would understand, the questions that they would be asked by a screener at the front door, the requirement for their body temperature, and if they did not meet that requirement, then they would be turned around at the front door. Just understanding the number of people that could be in one space. I think CAP has restricted assessors from representing any agency from going to patient care areas and patient care rooms. So that was different from us because this is typically an inspection or an assessment where the inspector would typically do tracers and things like that. And so that was different for us. The fact that the inspection was announced, we typically in the laboratory are used to having unannounced inspections and just, having an idea of when an inspector will come because you've got a window time frame, right? And then you've got your blackout dates, but you don't know exactly when they're going to come. And so the fact that, we knew exactly when they were going to come and we were able to prepare things like web exits, et cetera, was a little bit different for us. What I will say now is that our laboratory's window for open CAP inspection was actually last year this time. So we're about a year out from that. early on into the pandemic, we reached out to the CAP after the CAP made their national announcement that they would be ceasing international and domestic inspections just due to travel precautions, et cetera, et cetera. And we asked about our accreditation. And, anybody listening who has questions, I encourage you to reach out to the CAP as much as possible because this is a new process for all of us. But we reached out to them to ask questions about, would our accreditation remain intact? We were actually, our laboratory team was actually set to go on an inspection ourselves. And during this time where businesses were changing their travel regulations and guidelines, my health system's guidelines for travel had changed to business need and regulatory inspections only. However, our pathologist, their directive was that there was no business travel until 2021. And so obviously we were not able to conduct our CAP inspection for the other team that we were assigned to because our pathologists were not allowed to travel. And so that was, another consideration, understanding, the travel accommodations and the rules that your organization has put in place for travel and, the need for travel and if it's essential or not. So that was something that was new to us also. Our laboratory chose to do the hybrid inspection option just because we felt like that would work best for us and the schedule of projects that we have coming on site and in the other assessments that the organization as a whole has. We're very lucky in that our laboratory has a dedicated quality department that works closely with the hospital quality department. And so they were really instrumental in connecting with the CAP. And once our inspection was assigned, continuing to work with our laboratory and the hospital quality department to make sure that we kind of have a lot of things in place. And there's a lot of detail that has gone into it, and it's, like I said before, been a very different inspection process. Like I mentioned before, rather than being unannounced, we've had, almost daily contact with the inspection team, trying to put in different things that would work for us to have a smooth inspection process. So it's definitely been a learning curve. What have you guys experienced in with this new normal of virtual inspections?
So within our system, we are actually waiting for our inspection team to make contact with us, and we've also chosen the hybrid inspection route. We were pretty fortunate at one of our sites. They actually had an inspection before everything got too chaotic. It's still been in the pandemic, but they actually had a team come on site, and this was before you would review documents virtually. There was a small team that came. They reviewed the documents and did all of the inspection within 1 day, which is that site is typically a 1-day inspection. And what was different about that particular time is when we did the summation, of course, we couldn't have a lot of people in the room. We actually did the live stream component. So that was the only thing that was different for us on that particular inspection. That site had an extra inspection before they were part of the system inspection, which we are waiting for. And we are waiting. We had teams assigned to our regions, and because of where they live at, they had to cancel. And so now we are waiting for a team to be assembled for us. But what I thought about when Lona and both you, Stephanie, were talking about the hybrid and virtual inspection, just some of those differences. And Lona mentioned a few of them already, and you can find some great tools and tips on the CAP website, including a mini training for virtual inspections. But one of the things, or their way of comparing the two of the hybrid versus the virtual, is the virtual has a criteria behind it. I'm not sure of all of the semantics behind what criteria you have to meet for the virtual, but it does have a eligibility criteria versus the hybrid one doesn't. Both of them have the virtual document review of loading your documents ahead of time into some kind of cloud-based system or SharePoint site. direct observation, the hybrid model, you will have a team go on site. That team could be, one inspector, as I've seen one facility have done it. They sent one person to do the actual on-site, and everything else was virtual, or a smaller team. And then with the virtual inspection model, it's live stream. So there's no on-site. It's just virtual via live stream option. The inspection period is a little bit different between the two models. So for the hybrid, it's up to a week for a remote document review phase, followed by 1 or 2 on inspection within 2 weeks of completing that document review, whereas with a virtual model, it is as agreed by the team leaders, the inspection team leader and the lab director, not to exceed 1 week. The total inspection time is about the same as a traditional on-site inspection. So depending on how many days your particular laboratory or lab system was designated, that wouldn't change. The post-inspection process, how long you have to follow up and all of that, there's no change between the two, hybrid and virtual, in comparison to our traditional. And with the accreditation outcome, with the hybrid, you are accredited, you move on, it's business as usual. And with the virtual model, then you are accredited, but an on-site visit will be scheduled within 6 months or whenever feasible. And I think that's the reason why a lot of sites are not wanting that virtual model, is because of that. We go through all of that with the documentation, and we are in that inspection mode, and then 6 months later we still have to get, not that we should be CAP ready at all times, let's be clear, but with that virtual model, the inspection team does have to come within 6 months on site. So when you are in that whole inspection, you're like, let's just get it done and over with during that one time. And there was even a quote on the TAP website from a physician that just said, we are just anxious to get the inspection behind us and appreciate flexibility with some of the modifications in the inspection process. Overall, there's benefits. The benefits far exceed the drawbacks, and their team felt some normalcy once the inspection was complete. And that was from a physician up at the Cleveland Clinic. And I agree. I think there are some advantages and disadvantages to both models. One of the challenges that I see, and I would like to get you all's feedback too on this, is with most labs probably doing the hybrid approach and getting all of your documentation together, whether you're loading it in a cloud or loading it on SharePoint, and that review time. So our group is going to an inspection of another facility, and I'm just thinking about the amount of projects that we already have that we're working on and managing, reviewing all of those documents. Do you all worry about that time? Because, with everything being virtual, there's so much going on that's competing for your attention. Do you all worry about that in your labs, or have there been some discussion about the challenges of that, of getting everything loaded, getting everything prepared for the inspection group? And on the flip side, whenever you are getting inspected, having that time to be able to do all of this?
Yeah, so Tywauna, just listening to Stephanie's experience with inspection is really helpful to me, because our window opens up in April, and we were like, we haven't heard from anyone, and to hear that Stephanie's window opened a year ago, and they're just in the process of, getting things together. And another thing that's really helpful, just hearing from Stephanie's experience, is that once you start communicating, you can set that date for that on-site inspection. So because we haven't heard anything, we've been doing a lot of preparation, and we said, you know what, let's reach out to CAP, because if it's going to be a delay, we want to know, because many times we have people who are not taking a vacation during that window. We have different plans, but if it's going to drag out for another year, we need to have that. We need to know so we can make plans around it. So that's really helpful, and I'm sure that others will benefit from, the experience that each of us may have. So for me and my lab, some of the challenges, like Tywauna was saying, for us, I think it's a challenge now that would probably turn into benefits. So we don't have, a lot of labs have media lab, and we have looked at that. And especially now that we are thinking to go, share electronic documents, we looked again at Media Lab. But then we realized that there's a lot of Microsoft apps that's available through SharePoint that we can use. So we started looking at Microsoft Teams. And some of the challenges is just changing the way we've always done things. So you have some, because I'm from a big hospital, some departments are used to using Excel files and attaching documents and attaching links to procedure to prepare. And then you have some groups who are still using binders. So they still use those PDFs, and they put their evidence of compliance in those different binders. And, there's just a lot of work prepping for that. So now people are thinking we're going to do electronic sharing of documents. So people who are not used to using the Excel checklist, now they have to get used to that. Then people are getting used to using Microsoft Lists. So it's a whole adjustment for a lot of people, a lot of learning. It takes time. It takes time to upload these documents. So, yes, that's challenging, but we kind of knew that earlier on. The good thing about it is that our window is coming up in April, and the pandemic was like now a year ago. So we are aware that they were going in this direction. So we were able to plan and to come up with these Microsoft different teams, and so now we're preparing. So we had enough time to prepare, but it was a lot of adjustment to change from paper to digital. So that's one of the challenges that we experience.
Yeah, for us, luckily, several years ago, we went to an electronic document control system called PolicyTech, and that's worked for us, I would say, for the past 7 years. Now, I would say it was an overhaul to switch from paper procedures and everything into PolicyTech, and then to get users to be comfortable with that. You still have your people who want to print out that paper copy of the policy and have it, at their workstation right there available for them. But just, it did take several years for our entire team to get used to it. But now that we are used to it, it has come in handy, and it has turned out to be a huge benefit for our laboratory. And you mentioned Media Lab, and Media Lab is something we onboarded also. About 2 years ago, we have the competency version. So our competencies are electronic, and then we also have that inspection-proof portion of Media Lab, which for this virtual inspection has proved to be pretty helpful, because you can link your policies and procedures that, like I said before, we have in PolicyTech to Media Lab as links, as hyperlinks, into Media Lab. And so giving the virtual inspection team just guest access to our web-based software, Media Lab, has proved to be one of the ways where we kind of have worked the IT portion of the remote or virtual document review section of our hybrid inspection. You mentioned some of the things that you guys have challenges in working with and considerations, and that made me think of a couple of things that we had to consider. And so maybe the listeners who are tuning into this podcast may want to have these considerations for their laboratories also. And if we miss something, let us know, because I think we're all trying this together, and this is all of our first times with virtual inspections, and so the best practice, I don't think, has been established, and so I think we're working together on that. But like we mentioned before, the date is announced, And I think that's helpful because what we found is that many states and cities have different local or state restrictions just due to COVID. I live in Texas, and our Governor Abbott, recently lifted all of the COVID restrictions, publicly, so no masks are required, all of those things. However, in our organization, we still do have our organizations, our hospitals' restrictions, and so we wanted to make sure that we communicate those to the inspectors that, when they enter the hospital, they'll still have to wear a mask. They'll still have to adhere to, so many people being in a room, et cetera, et cetera. Our laboratory has an inpatient and outpatient component, so we've got 5 ambulatory stat labs around the city. And so one of the considerations we had to have was how many inspectors were coming overall. And because of the number of people that can be limited to a conference room, 4 inspectors and the team lead will be coming, so a total of 5. But we wanted to know how many people would be traveling to off-site to those stat laboratories because we wanted to make sure that we limit the number of people in a car and what type of car would we drive, and making sure that people understood they still had to wear the mask in the car. So when we have a member of our team, transporting the inspector to the ambulatory sites, we need to know how many people were going to be in a car, and did we need to have a mid-sized car or SUV to drive them around. And so that's some of the things that we also thought about. If you have off-site laboratories and inspectors are going to want to physically go to those laboratories also, you might want to look at the mode of travel and how many people will be traveling on that date of inspection. When we started working with the team that will be doing our inspection, one of the benefits was that the team has been, very accommodable and very gracious and kind, and we've been able to come up with a lot of dates that work for us. And so I think Tywauna mentioned the question of were we worried about having the time to do this, and I think all of this planning has helped us feel a lot more comfortable with the time frames. So a couple of things that we brought up as considerations for this CAP team was the number of documents that they were going to, because this CAP team has to be able to have time set aside to review all of these documents, right? And people on their side to do that portion of the inspection. Although it's remote, they've got to set aside dedicated time to do that. And we have to set aside dedicated time and point of contacts on our side to be able to answer questions for them and be available remotely to them. We decided to use WebEx for that time. So we came up with a date that we would like the documents that they were going to want to review from us, and a date that they would dedicate to review all of the documents. And at first we thought of a time frame of 2-week document review. We've since whittled that down to a 1-week document review, and then we asked the month before that date would start to get a list of all the documents they were going to want to review so we could start gathering those. The CAP does provide a SharePoint site option, so you can use that as an option if you don't have, internet-based softwares like PolicyTech or eLABorate, or et cetera, et cetera. It's just a lot of documents to upload to a SharePoint site. Then we decided, the week that they would be doing that remote review to have you can use Zoom, you can use Microsoft Teams. Our organization frequently uses WebEx, so we set up WebExes, and the 2 point of contacts per checklist, so say Tywauna, for example, were the point of contact to inspect my virology, checklist, and I were her point of contact being inspected. We would come up with a time to discuss, any questions she had about the documents that I sent per her request. Using WebEx, we could share screens, so I could show her different things if she needed to, and then this would go on for, an entire week. Within the next 2 weeks, they will come on site, and when they come on site, then that inspection will be purely a physical review of the laboratory. One of the other things we had to consider was early in the pandemic, we had some positions in our department that we deemed to be able to work remotely. So just understanding the manpower that we had and who needed to be on site and who needed to who could still be off-site for this inspection. Because we started, like many labs, doing COVID testing, we have some people that have different schedules now. They may have been working one shift and pivotal on one shift, and now they've switched to another shift to assist with staffing. So if you have people who are working different shifts or working remotely, you need to look at, what does your manpower, what does your team look like to gather these documents and then to be available to the inspectors. And then I would say also when you're looking at gathering these documents, sometimes, during the inspection, the inspector might say, pull one patient result that includes a critical value. So I can see that. If you're sharing this, usually the inspector's on site for a normal inspection, but virtually, if you're sharing these documents, you just need to always be aware of what are your organization's HIPAA guidelines, and maybe work with people outside the laboratory on how you would share those documents securely and safely without violating any HIPAA guidelines. I know as we were having the conversation, I think, just trying to find ideas, the ideal of FaceTime was brought up. And, I immediately went to, your cell phone is not a secure device to share patient information. So, let's look at other options. And so you have to kind of continuously think of that because it's not something that we normally do. Normally the inspectors are here for a day or here for 2 days, and we've got 15 to 20 people, in the laboratory doing an assessment, and now you've got the majority of those people, if you're doing a hybrid inspection, remotely doing that portion of your inspection and only a few people coming on site. And so just being creative on how you do those things. And then finally, even something as simple as the food options. So when COVID stopped, our organization stopped doing major catering, and that was just to be in line with different COVID precautions from our cafeteria. And so, I think we settled in on boxed lunches and cold sandwiches and things like that. But just, even in line with, sometimes you would have the pitcher of water with the little plastic over it and all of those things, to now we switched to bottled water and canned sodas and things like that. So do any of those things worry you guys, since you guys haven't reached the point that our laboratory has? It sounds like we're a little bit further down the road than you guys have had to go during this inspection process.
Stephanie, I'll just quickly say something that I find was kind of a learning, because when COVID hit, at the early part of COVID, one of our sister hospitals went through the inspection, and it was almost chaotic and frustrating for them. So I'm thinking that there's a lot of learning that has actually taken place since then until now, where you actually can set dates and time and be more organized. Because probably about 9 months ago, when they tried to have I think it was a hybrid, and at the time it was just document sharing, and it took them months to get those documents. It's after several months, they were still getting requests on the same thing, and it was really frustrating. So I'm thinking that there's a lot of learning that has actually taken place so far, where the feedback has gone back to CAP, and they're being much more organized. So, just saying that, so that if, people are listening to other labs with maybe the horror stories, just listening to you and your experience at this moment, because this is 9 months after I've heard, that it seems as if there's some hope that even though it's challenging, it's not that crazy. It's something that you can actually set times and dates and have a window in which you share your documents. This is the period of time we're going to share documents, and this is the time that you have to request additional documents. And it's not 6 months later you're asking me, what about this? And that was what they experienced. That was their experience at the beginning. So I think this is really helpful. And another thing that you said about HIPAA, we had that question. So, the answer was people kind of assumed, they were like, well, all the CAP inspectors signed, HIPAA guidelines, so that should be okay. But we're like, we're still curious about this because now you're sending out information to another institution. It's not like they're coming in, they're looking, and they're leaving things behind. And so when we contact CAP, they said it's best to remove PHI from some of those documents that you're sharing, because now you're going to have these sent to other places. And although CAP, I see on the CAP website where they're telling people not to print these documents at their institution, but it's safer that way. So I'm glad that you brought up the HIPAA part of it for others.
Right, and it's not just removing the PHI. It's, like I said, now, like you mentioned, people will come into your laboratory and leave these you would pull these documents and they would leave them behind. You can shred them, and you could be in control of the safe discard of the documents. But now that you're having to send these things virtually, I think every hospital has safeguards and firewalls that protect them against hackers and things like that. And so I think it's, from what we were told, it's the responsibility of the organization to make sure that they are protecting and controlling PHI. And so not just removing the PHI, but just making sure that you're sending it over a secure network or some type of secure fashion, or that you're posting it to a secure, SharePoint where you control the number of people who can access the information. And, for us, we weren't as worried about, our policies and procedures, but some laboratories are and might be worried about keeping their certain things private.
When I think about this whole process, and I'm not worried about our particular team and the hybrid inspection, but what it did make me think about is the people, because you're starting to use a lot of technology, and I know that people have gotten more comfortable with Microsoft Teams and Zoom and go to meetings, but it's not uncommon to be in a meeting and somebody not know how to share a screen or have difficulty or think they're on mute and they're not. And so those are some of the barriers that we have to work with now. But it makes me think about those inspectors, and I've been on numerous inspections and I've been inspected numerous times in my career, but thinking about those inspectors that actually like the paper manuals. So we have an electronic procedure system and have had it for years, but it never fails with our inspections. There's always that inspector or inspectors that wants a paper binder, they don't care. We can have everything linked in our procedure management system, but they still want the paper. So how has your teams had to adjust, especially when I say teams, I mean some of these inspectors that might be a little more old school in their processes and want that paper? How have they had to adjust with this whole everything's online, we are going to the SharePoint or whatever other electronic management system that you have for the procedures and for the documents? Have you found that to be, a bit of a learning curve for your teams, especially for some of your department experts?
I don't know if Stephanie want to jump in, but for us, at first, when we, speaking of the people being inspected, and then I'm going to talk about the inspectors, for us, some people moved faster than the others. Some lab sections moved faster. But this year was the year that told everybody that even if you wanted to hold on to your paper, this is the time you're going to have to adjust. And surprisingly, we didn't have a lot of people kicking and screaming. They were like, whoa, we have to do this, and we have to do it now. And they kind of started hustling. And people who were not on electronic, they were moving fast and like, we need to get this done. So they got support from their team, from their leads, and they actually got really serious in getting everything up electronically. And for my experience with inspectors coming, we have always had our policies and procedure we have a home homemade system that we have our electronic policies, and we basically just said this is where it is, because we have gotten rid of paper policies a long time ago, and if we found anything on paper, it's like they're kind of in trouble, because we know we've had experience with inspectors inspecting us, and they pull out a policy that's outdated and expired. And so they know based on that it's like we have a no-nonsense policy where that's concerned. So in terms of our SOPs, they're all electronic. So when an inspector comes, we're going to guide them, we're going to log in, we're going to show them, sit them down, and this is where you find things, and if you need anything or any question, I'm here. But even if they insist, we don't have paper. This is where our procedures are, and so that's what it is. So that's
and I'm actually looking at the document that we got from the CAP about our modified hybrid inspection, and one of the bullets actually reads, the laboratory will provide or make available electronic copies for review by the inspectors. So I think if you have people in your department that are still, I guess, quote unquote, tenured or not as technology, pro-technology, or I guess we could say old school, then like Lona said, this is the time for them to change, because it's basically in these documents that we want as many things that can be remote to be remote. And then for us, we looked at it as part of our resources. So we have some sections that are faster than other sections at putting this together just because of the teams. And so we pulled together and had certain teams help other teams to move that process along, so we could all meet the same goal. This isn't a time to kind of be siloed and be like, I'm virology and I'm, not virology, I'm point of care modified, I'm, lab limited, and I'm only going to do lab limited. This is really a time for your entire team to pull together. And if you got a person who's really fast at cutting and pasting links or, uploading things and really quick, and you got another person who's really slow, it's really a time to divide and conquer and see where your strengths are, especially in terms of the IT realm. And get those things going. One of the things that we also did was we agree that it's not uncommon. We actually have, many inside jokes about it, that you sit on a conference call and somebody gets called and you hear moments of silence, and then you hear them and they go, oh, I was on mute. Or for somebody to think they're on mute and actually you hear a bunch of dogs barking in the background or something. Or for them, like ordering their McDonald's or something. And so what we did was we put together like a WebEx training, and we made it a video, and we sent it to all of, especially the point of contact for the CAP inspection team, but all of our managers and supervisors, so you can have some practice and feel like you have a little bit of expertise in terms of the software that we planned on using. So if you have Microsoft Teams or Zoom and all those things, it might be worthwhile creating or having somebody, do a little just quick overview. Even if you think you know everything, there might be some tips about Zoom or Microsoft Teams or WebEx that you don't know that might be helpful for you when you're going through the inspection process.
I don't know if Tywauna, but Stephanie, that brought up some memories. Our preparation, we got together as pathology department in my organization is huge with a lot of different labs, a lot of different managers, and we got together through our quality department, and we had one person who had expertise in Microsoft List. And he put together a lot of training. We put together a team so that we can ask questions. And then we decided to have one common SharePoint for all these labs, that usually one lab would have so many different lab sections working by themselves. Now we have one SharePoint where they are dumping their checklist into one place, and there's like a status update. So in terms of preparation, we're giving status where we are, and then there's a group who are saying, do you need support? And even at the lab level, we are saying, okay, this is our status this week. who can help with what. So I think that's a great idea to kind of support each other. And that's kind of what we've been doing in terms of preparation, trying to get volunteers to help with uploading documents and people who have more expertise to do training and do like screenshot training and video training. So that's what we've been doing also.
That's awesome. I think that's good to be able to make sure that the team is prepared and ready and the staff members are prepared and ready. So I really think the hybrid and virtual inspections, I think it challenges our teams. We have tons of automation. If you think about it, we have tons of automation and robotics in our laboratory, and it took the pandemic for us to really get up to speed on some of the web conferencing apps and conference calling and remote work and some of those things. So I think it's a great thing. The only thing that I'm going to miss is that since we are doing a hybrid, we are not able to take as many team members, and we typically take a newer tech as a training opportunity. So that's the only thing that I think I'm going to miss, at least that comes to mind right now. It's being able to take that person and kind of shadow to get the experience of doing an inspection. Any final thoughts about it all, about the hybrid versus virtual inspections or where we are today with inspections?
I would say I love the fact that even though we have challenges, there's a lot of benefits that's coming out of it, and one of it is actually going paperless. Sometimes we think that there's no way we can go paperless with this. And so it's a way to kind of bring us to that point. And also, I think the benefit of learning new technology and knowing that we can use these technology, I find that really beneficial.
Well, like we said before, just like everything else, this may be our new normal, at least for the short term, or for the unforeseen future of how we make sure that we are working with our regulatory agencies to ensure high quality in our patient testing. And so this is something that everybody has to work together on. So if you have other things that your laboratory or your organization is doing to prepare for regulatory inspections, make sure that you comment or reach out to us, because like we said before, the best practice is still being developed as we're all in this together and we're all continuously learning. And we'd love to hear how your team is addressing the changes to the inspection process in your laboratory, and love to hear anything that you have that you're doing that we haven't mentioned so far. Thank you for tuning in to our roundtable today as we talk about virtual and hybrid inspections and how to prepare for those and our experience with each. If you like what you heard today and you want to listen to our previous shows, please subscribe to our podcast at directimpactbroadcasting.com or on one of your favorite podcast platforms. Tune in next week to hear another amazing episode of eLABorate Topics, and until then, have an amazing day.
Thank you for tuning in to another episode of eLABorate Topics, where your hosts discussed relevant strategies for laboratory professionals. Please subscribe to this podcast on your favorite podcast platform and listen to us on directimpactbroadcasting.com. Stay tuned for another episode with information you can use to excel